safely reopen pretty much all of our outdoor facilities. With respect to our indoor facilities, as you probably know, the town hall is open on an appointment basis only. We've got staff, roughly 50% of the staff in here on any given day. If they're not working at town hall, they're working remotely from home. The library now is taking people in on an appointment-only basis. We understand the senior center isn't quite there yet. We're waiting on guidance from the state. I'm sure we can talk about that more later on in our conversation. And then just a couple of other sections I wanted to mention. We have a community support team that's in place as well. And they've been focused on supporting our residents, our citizens, including those with some special or acute needs. And we did a lot of that work early on. And then we've also been working to support our West Hartford businesses. That's been an ongoing effort. I've got a few other things I'd like to touch on, Bob, but do you want me to pause there and take questions on what I've said today or keep going?
Why don't you keep going?
Will do. So we've got this incident command system still in place today, as I just described. We expect the pandemic is we've got a ways to go still. We've tried to be very realistic about the timeline. We're members of a regional health district, the West Hartford Bloomfield Health District. I am the current chair of their board, and really want to thank the health district for the tremendous work they've done throughout the pandemic. The director is Amy Kraus, and she was promoted, maybe 6 to 8 months ago. And I think the pandemic really illustrates the need for any community to be able to have a robust public health department. Right now, they're in the process of conducting their flu clinics. And then when we get the COVID vaccine a couple months down the line, they'll be providing COVID vaccinations as well. And I know that Gina and others will keep you informed when we get to that step. But Amy shared what I think is an amazing statistic with me earlier today. I'm sure you're all familiar with the term contact tracing, and that is when you're trying to trace down the number of people that someone infected may have come in contact with. Anyhow, since late February, our health district staff of roughly 12 to 15 people, they have been in touch with a little over 40,000 people. They have had over 40,000 individual contacts. These are all people who may or who may not have come in contact with someone who tested positive. So really, really extraordinary work on their part. A couple of silver linings in all of this, if you can use that term in the context of a pandemic. As we always say, right? A crisis is the mother of invention. So what have we done here? I think we've really, as a community, we have stepped up to help support outdoor dining and outdoor retail in areas such as Town Center, Blueback Square, Park Road, Bishop's Corner, and other locations. And actually the town, as you probably know, if you've been patronizing the center or Blueback Square, we have converted parking spaces, sections of the sidewalk, etc., for our restaurants and retailers to use for that purpose. And on a nice day, it's actually quite a nice environment. and I think something special. Then another thing we've been able to do is we've learned that we've been able to provide the vast majority of our administrative services in a virtual manner, either online or through the old-fashioned telephone. Obviously, public safety, public works, there are a large number of us that still need to have that direct face-to-face contact in order to get the job done. But it's been surprising how much of our work we're able to do in a digital manner. So let me pause there, Phil, and I would like to, if now is the right time, turn to Helen and Gina to talk about the work we're doing specifically for our senior community, to support our senior community.
Good morning. This is Helen Rubino Turco, the Director of Leisure Services and Social Services. And I just wanted to acknowledge, this has been a difficult time for our community and for our country. But I think that the structure that Matt described in terms of our response and our recovery has been done really, really well in a very thoughtful and systematic way. And one of those items that we discuss on a regular basis is obviously the closure of facilities and then their reopening, their gradual reopening. And we've done this for a variety of facilities, including, as Matt mentioned, some of the amenities in our public parks. Our parks remained open throughout the coronavirus, throughout the pandemic so far. But with some additional oversight, if you will. We've, in the summer, when activities started to get busy, we had park ambassadors in each park that helped support the health districts and the town's initiatives about how to operate safely, how to be safe, how to wear a mask, and safe, physically distant from each other. And one of those, obviously, closures that affects many of you is the closure of the 2 senior centers. And Gina Marino monitors regularly what the recommendations are from the state and then communicates those, and it's discussed internally by the municipal operations recovery team. And that is another one of our committees, our town staff committees, that reviews any reopening of a facility. And so it's our recommendation at this point that the senior centers and their fitness centers remain closed. The governor still recommends that people who are over 65 or people who have medical conditions should not mix in the public and should remain separate and safe. So we continue to monitor that and to see if there's ways that we could consider safely reopening our senior centers in the future. That being said, just because the doors are closed does not mean there haven't been a lot of activities going on. And I'm just going to let Gina Marino explain a little bit about how we shifted from an in-person programming to virtual programming or meeting by phone, because she and her team have done a fabulous job making sure that virtual programs are being held. Before she starts that, I just also wanted to mention that one of our early committees was a collaboration with the fire department and social services. And the fire department maintains a list of vulnerable or medically compromised people in town. And Matt Hart very much wanted to make sure that no one fell through the cracks when the pandemic hit. So many people who had a support system around them, that support system may have crumbled because the person that was doing their grocery shopping maybe didn't want to go to the store, or a person who regularly visited them didn't want to spread the virus to their elderly neighbor or relative. And so we devised a community outreach phone tree that involved three. This list was divided into three, and the fire department took people who were had a medical challenge, like were on oxygen or needed had medical issues. The second were people who had multiple issues, whether it was um, food or other needs that weren't being met. And our social workers took those lists. And then the third list was people who ordinarily could function on their own, but because of COVID, their support structure was compromised. And we had some staff who volunteered to call those people. And this program went on until the middle of June. It was really successful, and a lot of people answered, appreciated the phone calls and the support. So that program has ended. The fire department still maintains the list of the critical or people who have immediate needs, and then social services continues to support people who have multiple issues. So they've sort of maintained that, but the third list has reabsorbed back into the community and is functioning well. So I just wanted to again pass the baton to Gina Marino to explain about what's been happening since the doors closed.
Good morning, everyone. This is Gina Marino. All right, we've been very busy. With the phone calls, we also thought that we needed to reach out to all our members, and I believe many of you assisted in some of those phone calls. We went through and called all our members once and left messages or spoke to people, and we are following up with a second round of calls. One of the main purposes is to see if anyone needs a weekly or monthly call, just to see how they're doing, and also to make sure we have a correct email address so that we can contact them. We've been doing 2 emails a week. Every Monday morning, they get an email that states what's going on for the week, different opportunities. We have many virtual programs. I just counted this morning, there are 19 different opportunities in 1 week to take an exercise class, all different classes, which is phenomenal, really. And we have concerts that we've been doing. We're working with the retirement communities to sponsor some of these programs. And everything is virtual, so if someone cannot go on Zoom, they can also call if they have a smartphone and listen to the program, which has been very interesting. On Fridays, we do something called Fun Friday, and we scour the internet for different virtual opportunities for people. There's many free Broadway shows, tours of facilities, art museums, Beardsley Zoo is doing some virtual programs. So we're trying to bring in some different kind of opportunities to people on Fridays. And people, believe it or not, really love that Friday email. We have, I believe, close to 1,500 people that are signed up for our constant contact emails, which is also very good. We do have a percentage of people that do not have emails. They did get the bulletin, so there is a hard copy of all our programs listed there. We are also working with Jen from West Hartford Community Interactive, and we have dedicated time for senior programming on Tuesdays and Thursdays from 10 a.m. to 12 p.m. Jen and her staff also live streamed our Bristol Old Time Fiddlers concert beginning of September. And that was put on YouTube. Lisa Hans, which is one of our part-time staff, created a YouTube station for us. So we have different videos that are on there, and that particular video is on there. I don't I'm not sure how many. We currently have 1,617 views of our YouTube station. And we had a total of 56 hours of viewing time. So that's something. We're working with other senior center directors. There is a chart that other senior centers are putting out with their virtual programs. And we pick and choose if it's something we think our people will like, we forward to all the people on our email list. So it's a great opportunity to expand our offerings. Everything we're doing is free of charge. Most senior centers in the state are doing free programming. All our instructors for our classes volunteered through the spring and the summer. So it was a totally free program. We are doing some grab and goes, which is a little bit different. We don't want to encourage people to go out, but this is in your car. You're going to come to either senior center at a specific day and time and get a gift of sorts. So for instance, we're doing a virtual bingo later in the month. So we have Doncaster who's sponsoring the bingo. They have created nice bags that have some of their information in it as pens and pads and water bottles and different kinds of goodies that people like to get. There'll be some snacks in there. They'll pick up their bingo cards, a dauber, and the rules on how we're going to do this. So people will come and pick this up the day before the bingo is scheduled. They'll either call in or go in on Zoom and play bingo with us. All the prizes are gift cards, which will be mailed out, and they were donated by Doncaster. We have 6 of these scheduled throughout the fall and through December. So we have several programs of that sort that we have scheduled for the fall. We have a jukebox bingo scheduled where they'll actually come and pick up a boxed lunch and bring home and enjoy it. We also have, for people that don't have any computer access, or if you can't even, if you do, take and create art projects for home. They'll get a kit that'll have all their materials in it, as well as some snacks, and that's also provided by a local retirement community. So we've reached out to the community to help us so that we could make all these programs free of charge, because we know people are feeling the squeeze with everything's going on. And so far, we're getting some good responses. One of the other things that we're doing, because we know technology is one of the biggest issues right now, is we're working with a local business who is going to secure used computers and hopefully get them into the homes of seniors that don't have computers, but are interested in learning how to use them. Right now, we've gotten 3 requests so far, 3 letters from seniors looking for these computers. And we're working with WeHa at your service. The young students from the high schools are willing to help the seniors over the phone on technical issues that they're having. So we're trying to piece that together so that people that want to use technology can afford to use technology. I think we're looking at, we've been very cautious as to sending the correct message. People 65 and older, stay home, stay safe. That's the message that we've been getting from the state. That's the message that we are putting out there. With that said, we are trying to do some outdoor activities while the weather is still nice. We are working on a Halloween parade. It would be a car parade. The seniors would come in their cars. They could decorate their cars. They would come in costume if they had a costume and they'd like to do that. They would be given some treats, possibly a craft, and maybe even prizes for the best decorated car or the best costume. So that's in the works right now. I did get an email from a member wanting us to do some kind of football grab and go. So we're working on something for that later in the fall or possibly in the new year. And also working on trying to get some people together to safely, socially distance walk on Trout Brook Trail. We thought that would be a nice opportunity for people. So we've been getting some good suggestions. We do have seniors that are emailing us different events that they see that we're passing along in our Fun Friday, and even suggestions for classes. The other thing is we're extending our reach. We're getting calls and emails from seniors from local communities that want to participate virtually. So my hopes are when we open, we will have even a grander list of people that will participate. And we will continue to do virtual, even I believe after everything is declared to open up and have people come to the centers, because we are reaching people that maybe wouldn't normally be able to come to the center. So that's the good part of all of this, is we're making new friends, reaching out to people we haven't reached before. And everybody's growing a little bit. There are pains with it, but we are all growing. I've already been approached by AARP Taxes. They're interested in coming back in January. So we're putting down the groundwork. So hopefully we can start that income tax program again. That was one of the biggest issues when we closed. There still were so many people that didn't have their taxes done. So if we can work some kind of system out for that program, that would be great. I think that one's a very important one. We've been able to offer choices counseling by phone. Our volunteer has been very good and has been able to help everybody who's made an appointment. We do have Lisa on staff, who is our technical expert, and she's been walking, she is so patient. She is walking people through the process of using Zoom, of using Google Documents, a lot of one-on-one, so much so that we're actually doing classes this fall for people that have the basics but want to know a little bit more. So we're really trying to target technology. Trying to think what else I can. We're low staff right now. As you know, Kathleen retired. And most of our part-time staff needed to be let go. We're holding our heads above water because we have a few dedicated individuals who we're really targeting what they're good at and what we need to offer. So we're doing really well. I'm happy with the product. We've gotten a lot of compliments from other senior centers as well as from our general population. So we're happy. We're open to any comments, suggestions, ideas, because now's the time for the ideas. Does anyone have a question for me?
Gina, this is Phil. That's a terrific report. Is it too early to estimate when you might be back person to person, open up the centers?
Yeah, that's the question. I meet almost weekly with other senior center directors via Zoom. And there's a survey done almost every single time. When do you anticipate opening? One center said October. One center said November. Several centers said December. The majority of the centers are saying 2021. So it is so hard to tell because every day something different happens. With the schools being open, knock on wood, West Hartford's been very fortunate. I think we're very careful. So we haven't seen any increases. Flu season is coming. That add to the safety issues. So I can't even give you an educated guess as to when we would be opening. Helen's got a suggestion.
So this is Helen Rubino Turco again. I just want to reiterate what Gina is saying, and that is that the safety of our seniors and our frail people, in addition, it comes first. We have operated Dial-A-Ride throughout this pandemic. We did shift our programs using Dial-A-Ride to make sure that there were no rides were being shared, and there were strict protocols, safety protocols that were in place. We did restrict the rides to going to the doctor or to the grocery stores, but many of the other activities that seniors might have wanted to do were closed down, like the senior centers. So we continue to try and support our senior population as much as we can, but safety is our primary concern. I also wanted to mention, many of you or some of you participated in a Zoom retirement party for Kathleen Ferroni, who retired in June. She's doing great. I still see her photographs. One was featured in the last bulletin. So she's eager to remain connected to our community. Anytime there's a change in staffing, it's an opportunity for us to assess how we're doing and what we could do better. So we'd love to hear from you on that. But it is our intention that Gina Marino assume the position of Senior Center Director to oversee both senior centers, and to hire an assistant director to support her. Gina has obviously, you know how wonderful she is, what a great resource she is. She has experience at both senior centers because she was the Senior Center Director at Elmwood for years and then shifted over to the West Harvard Senior Center. But throughout this pandemic, she's also just really shined in terms of communicating programs, creating programs, and making sure that everyone feels connected. And I just want to thank Gina for her efforts, particularly since March, but also with the departure of Kathleen, to really take over and kind of merge the communications. There's one list. There's one set of programs that everyone can share. And I hope everyone just really acknowledges how hard Gina's been working to maintain the level of support. Thank you.
I'm very fortunate. I have 3 very dedicated part-time people. So we're able to pull it together. Good team.
Well, Gina, this is nothing new as far as we being in your debt. And you and of course, Kathleen just did a wonderful job through the years that I've been on the commission. And can I ask the people from the town here, Matt and Helen and Gina, my impression is that the West Hartford citizens, and particularly the seniors, have been very good as far as following the recommendations, as far as using masks and avoiding incidents of whereby they may threaten the spread to others of the virus. Do you think that the message is getting through in that way?
This is Helen. I agree that our senior centers and our social services department has also really been vigilant about communicating and supporting the seniors. Karen Paquette can probably talk a little bit about the mask distribution program. Many people, when COVID-19 hit, many people wanted to give and many people needed to receive help. And so one of those areas was in masks. There were a bunch of people that needed masks, but there were also a bunch of people in our community that wanted to make masks and give them out. And so Karen and her team identified one of their social workers to sort of be the Grand Central Station of mask distribution, collection and distribution. So I'm sure Karen will talk a little bit about that, but we also received donations through the Town That Cares and through the food pantry to support so that seniors didn't have to go out or venture out. And I think that helped support the overall messaging. But I'll hand it to Karen Paquette maybe to just talk a little bit about how our social services department addressed many of your needs.
Well, the question I wanted of you was how well are your efforts working out with the citizens? Are they following your lead by taking the steps that are recommended to keep safe? Wearing the face mask, not gathering in large groups, staying away from circumstances that would foster the spread of the virus.
Yeah, Phil, this is Matt. I can respond to that and more generally. So it really is amazing, isn't it, how powerful a simple face covering can be? You know, I think we all wish we knew that at the beginning of the pandemic, and that we had learned from other countries around the world, particularly those in Asia. But hey, it took a while, and now we have learned that lesson. So that is the number one complaint the mayor and I have received over the past many weeks, is just concerns about people not wearing face coverings. You know, early on it was primarily in the grocery stores, but then it quickly became switched to outdoor environments, particularly in the center and Blueback Square. So it's been an ongoing education effort. I think oftentimes people don't realize that even outdoors, if they're going to come in close proximity with other people, they should have a face covering of some sort. So again, we've been engaged in this education effort for weeks, months now. You know, we are seeing progress. I also want to commend the mayor, Sherry Cantor. I'm sure you all have received her updates either by phone, text, or email. You know, that's just one of the many communications tools that we've employed. We've posted a lot of signage. We've done a lot on social media as well. But that probably has been one of our most significant challenges with respect to enforcing the state's rules.
Well, good for you.
Oh, Phil, one other point on that. I almost forgot. So you probably read yesterday that Governor Lamont is going to be providing municipalities with the option to issue specific citations for a violation of the rules. This is something that West Hartford and other towns and cities have been pressing for weeks. So now our police are going to have the ability to issue a citation if someone's not wearing their face covering when they should be. I think that's going to be $100, that penalty. They're also going to be able to issue a citation to someone who's hosting a gathering with more than 100 people as allowed by state law. The violation for that fine will be $500. And then we'll also have the ability to cite someone attending a party within in excess of the maximum number of attendees. So, you know, we're going to be very judicious in how we issue these fines. We're not going to issue them willy-nilly. We'll have a good plan, and we're always going to try to give a warning first. But that should be a very important tool, and it's something West Hartford has been seeking for many weeks now, and want to thank the governor for coming around to that decision.
Well, good. I'm glad to hear that this is being considered and it will be enforced judiciously. As we get the message out, I find when I go into supermarkets and people are wearing them almost universally. So this should be a no-brainer for people with the situations where you're concerned about, and good for you. That's great.
Karen, maybe you can chime in with your piece. You need to unmute yourself.
Yes, I was. Yeah, it's good to see everybody again. As was mentioned, like other staff at the town hall, when the town hall was closed, the social workers continued to work full-time remotely, and now we're there on a staggered schedule. And again, like others mentioned, we learned so many lessons, and we still are. We learned ways to do things remotely that we always thought could never be done remotely. And it's been very helpful in many cases. And, we never stopped taking referrals, and we continue to do that. And also, I was going to mention, this also was mentioned too, but at the beginning of the pandemic, there was we participated in a very big collaboration with the fire department, the police, the library, the senior centers, volunteer services also were involved in reaching out to the homebound and medically fragile. So we could make sure nobody was falling through the cracks, those people that couldn't get out and maybe didn't have people to help them, especially in regards to food and medication. And it really was, it was a village, it took a team to really bring it all together. There's lots of information constantly changing on what was happening, on resources, and it really was tremendous. As Helen mentioned, Deanna, one of our social workers, organized and managed a mask distribution program. We had many volunteers that wanted to make masks. We distributed masks to all the senior housing complexes and to anybody else that called and needed one. Also through the food pantry. Gina got some donations of hand sanitizer. We were able to include a lot of them. And we still have masks. We still have volunteers that want to make masks. So if there's anybody out there that is still in need, you can call our office. We have been delivering. We have been meeting people outside. Any way we can think of to get them out to people that need them. And just like, the social workers, the food pantry and volunteer services also changed their delivery of services. Currently, the medical escort program is on hold, but there was, a massive outpouring of volunteers that wanted to help with the food pantry. We had increased need in food, as you can imagine, for a lot of people. And so we had volunteers that were organizing, that were delivering, and we currently have curbside pickup for the food pantry 3 days a week. We have people that'll shop for those that are homebound. We've all been sharing, delivering food, and trying to keep track of all the different food resources that have been popping up around the state to help people in need, and making sure people are connected to those. In addition, the schools have provided lunches over the spring and summer, and they continue to do so. The CRT meal program that was at the across from in the West Hartford Senior Center, they could no longer have people come, but they had a pickup of the meals, and people that could not go to pickup, we connected with delivery of the meals. Dial-A-Ride is.
The same thing happened at Elmwood Community Center too. The CRT
Yeah.
lunch was by pickup. Yeah.
Right, sorry about, yes. And the Dial-A-Ride, as Helen mentioned, changed their delivery to make it safer. So no more group rides, only a single person, and following all the CDC guidelines. And we continue to take applications for that. The Greater Hartford Transit District also implemented similar methods, just single rides only. And they actually waived their fees for the whole shutdown and until October 1st of this year. So that was a big help. Our farmers market program, farmers market coupon program still ran. We distributed to all the, again, the senior housing, and anybody, anybody can pick. We still have a few left. And I guess they can be used until October 31st. So any seniors that qualify can call our office and we'll send them out or meet you outside. The Energy Assistance Program has started taking appointments, and they also are doing everything virtually, so by phone or mail or dropping off paperwork. And he's very busy right off the bat. There's a lot going on and sort of information changing with utilities, with utility assistance programs, with the moratoriums. So we are constantly keeping track of that, trying to inform people as much as possible. As you're probably aware right now, the utilities cannot be shut off for non-payment up until October 1st. So people are protected if they can't pay. But there's been a lot of work behind the scenes between the regulatory agencies and the utility companies to make sure the utility companies let people know about what kind of help they can get, what kind of payment programs they can get on. So if anybody has any questions, just please call our office and we can guide you. The renters rebate program has been in full swing as well. That does end September 30th. We have been doing everything by mail or email as well. So if you know anybody, please encourage them to call our office to apply. And like Gina mentioned, the Choices program has been running also virtually, telephone appointments, and that seems to be going well. Does anybody have any questions?
Karen, I would just like to add, for the lunch program, the CRT lunch program,
Yes.
in case people aren't familiar, you can get 5 frozen meals. It's good for the week, and they also have some stable shelf items. The rate went up to a suggested donation of $3 per person. And CRT has decided they're keeping this process with the pickups, frozen meals, through the end of the year. So they will reconsider having the sites on site for the new year, 2021. It was just in a meeting that I was at, so that's why.
That's great. Good to know. All right. Well, thank you. Thank you, everybody.
Yeah, thank you, Matt, and thank you, everybody from the town. We appreciate it very much, giving us the rundown on this. And it's a great comfort to know how well you are taking care of all of us. And we appreciate that.
Well, thank you, Phil. It's been an extraordinary team effort, and again, something we take quite seriously. There's a ways to go still, and by working as a community, we'll get through it.
We'll stay in touch. Thank you so much.
Thank you.
Well, this is Phil again. I think I thought that was very worthwhile doing, and I appreciate very much the input. I don't think we need to get reports, any further reports from Karen or from Gina. Is there? I'm wondering, is Kevin on?
Yes, Kevin is on.
Yes, I'm here, except I'm invisible.
So am I. Can you give a report?
I certainly can do that, yes. It's great to see everybody and to hear from people. Excuse me for not being visible. It's my first adventure with WebEx, and my system is keeping me that way for the time being. We have been through a roller coaster ride, as many of us have in the past few months. We continue to provide service, provide rides for seniors in March. However, March 30th, we chose to suspend service for all purposes for obvious reasons. And we were not providing service in April and in May. And we began again to provide service on June 9th. We did so under strict safety protocols as provided by CDC in Connecticut and others. Currently, our passenger, it's usually one person, rides in the rear passenger seat if at all practicable. Each party in the car wears a face covering, and we sanitize the area of the rider before and after each ride. And we do our best to maintain a distance between the parties. In the past, and usually, our drivers provide direct physical assistance, if you will. Usually that's in the form of an arm helping someone to walk. We're trying to avoid that now, though we occasionally still do that if someone needs that. And in that case, we ask the driver to bring a separate sleeve shirt, which is used only for that purpose and then laundered. So we're doing what we can to limit that aerosol route and that direct contact route when it comes to providing rides. Now, providing rides for us has been a challenge in a couple of ways. Only providing half of the number of rides that we were in February, and that's just because demand is down for obvious reasons. Many of our riders are not comfortable going out and about, and therefore most of our rides now are for medical purposes. Typically, our rides are for any purpose. It could be a movie or theater or playing cards with a friend or a restaurant or what have you, but those are very much not being done very much. Currently, it's mostly medical purposes. So in that, we're providing half the rides. The other restriction we have, only 1/4 of our volunteer drivers are currently willing to drive. So those who are driving are very busy, and we're doing our utmost to satisfy every ride request, and we are able so far to be able to do most of those. But our most is in recruiting new volunteers. So I do mention that, and I will mention that anytime I have a public about that aspect of things. Back in February, when we last met as this group, I did report that we had a grant from the Fisher Foundation of the Hartford Foundation to allow us to hire a ride coordinator. That would be a second part-time employee to add to what I do as executive director. That hiring was delayed somewhat by COVID-19, but on July 1st, I'm happy to announce that we hired a woman named Michal Lowenstein as our ride coordinator. She's done a great job since then, and it's a welcome addition to what we are doing. And I guess COVID-19, one positive note is that she had a reduced workload to be able to segue well into her new role with us. We are doing reasonably well. We've had people in the community without being asked because of COVID-19, and we very much appreciate that. More than half of our funding to cover our expenses comes from the community at large, individuals, businesses, and foundations, and the minor portion comes from fees we charge for rides. and our ride fees are quite affordable, half of what taxis charge, for example. We did get support from the federal government, the Small Business Administration, $1,000 EIDL and a $3,840 Paycheck Protection Program forgivable loan. Now, I can say that I am our person who is in charge of the paperwork with these two programs, and I really don't understand it very well, especially when it comes to the paperwork we have to do going forward. So if anybody from the town could offer me assistance offline, not right now, in those regards, I just need some advice, because when I go on websites for the Small Business Administration, I really don't know what they're trying to tell me. And lastly, and very importantly, I want to thank Gina Marino for creating the idea for a opportunity for ITN Central Connecticut to share with seniors in the community in a Zoom meeting format, a program which we're calling What Do You Do When Mom or Dad Can No Longer Drive? And that'll be on Tuesday, October 13th at 6 p.m. by Zoom. It's going to be our local cable television provider, the people in Town Hall. And so we're thankful for that, and we look forward to everyone being engaged with that. Please join us that evening at that time so that we can have a good conversation about how we can help seniors. And we do that at ITN Central Connecticut, and Karen Paquette reported that the town does so through Dial-A-Ride. So all of the avenues opportunities are important to our senior community, and we at ITN Central Connecticut support all the options because we're just part of the solution. So that's my spiel for today. I'm happy to answer any questions.
Thanks so much. I'm amazed you've kept things going so well, and with this challenge, and we always look forward to hearing from you.
Well, thank you, Phil.
Bill, Sheila Diamond is on.
Oh, Sheila, good to hear from you. Yes, can you bring us up to date on the Senior Job Bank?
Sheila, you need to unmute yourself.
Okay, can you hear me now?
Yes.
Yes. Oh, thank you. Hi, everyone. Great to see most of you. Some of you are initials, which I am as well. And I'm sorry you can't see me because I dressed up for this meeting. So I look pretty spiffy for a change because I usually don't dress up. I am working from home and have been since the town hall closed. And so the one thing I really want to stress to everybody is the Seniors Job Bank never closed our doors. I was able to just pick up my computer and my records and just transfer my office, to my home. So that was really great to be available for people who needed our services. And so, not surprisingly, the number of requests we got from people really, plummeted in the spring. It was pretty quiet, though. We did have requests for gardeners and handymen who do exterior work. But just about everything else shut down. I am happy to say that we did get some calls from various social services departments because I guess when there were no medical transport options available, people did contact the Seniors Job Bank, and we did have drivers available, people who wore a mask and were willing to take, individuals who had critically important appointments and they weren't able to get to them in any other way. So of course there is a charge for our service because, our mission is to help people find jobs. So they do charge to drive, but again, we were always open, and not only do we do local rides, but we have people who will drive individuals to New York or Massachusetts or anywhere. But mostly we are providing rides to medical appointments and colonoscopies and medical procedures that people really, can't get to without an individual driving them. And so even though our requests for help have sort of been down, I've been really busy doing administrative type work. I have to say we have some really interesting projects in the works. We had an intern, a high school intern from Avon High School this summer, and she was really helpful in terms of creating marketing materials. We have implemented surveys. Probably wasn't the best year. If I had a crystal ball, this wouldn't have been the year I would have chose to implement surveys, but you know, it was in the works. And so we are surveying people using our services and, you know, getting some, I'm sorry about that, I'm getting some good feedback for the most part, and some, you know, helpful information and ways to tweak our system. So that's been exciting. We're also working with attorneys through the pro bono partnership, and we're doing a review of our legal, you know, of our practices and our forms. So we're doing a lot of sort of administrative, you know, behind the scenes work right now. I have to say, I'm happy to say that in the last month, we've seen an uptick in requests for, we've received an uptick in jobs from businesses. And I apologize for being late, but a business called me at like a minute to 10. And those openings are just so valuable to us. We have over 600 people looking for work. And more people are signing up. You know, unemployment is so high, and people really, really do need those regular part-time jobs. And so, you know, we have recently just seen an increase. We placed someone in the last couple of weeks at Collinsville Savings Bank in a courier position. We placed someone with Montessori School, a bookkeeper. So those jobs are out there. And I did read an article in the Wall Street Journal yesterday that a third of small businesses have openings, and they're just finding, you know, they're finding it difficult to find qualified candidates. So our biggest challenge is getting the word out there, and that's where I really do appreciate your help. You know, sort of spreading the word. We're a free resource. We have a really wonderful, knowledgeable, reliable group of individuals looking for work. And if anyone knows of an opening, particularly for a regular part-time job, I definitely appreciate the referral. And so let me see if there's anything else I really need to tell you about. I would just say for us, fundraising has been really, we've received an increase in fundraising this year. Lots of great support from foundations and individuals. And I thank you to all of you who've contributed to our COVID-19 emergency fund. So that's really the only silver lining for us this year, is that there's been an increase in donations. So that's been really helpful, because we are really about to embark on a marketing campaign to try to let businesses know that we are out here, you know, and again, a free resource. So that is my report for today. Again, happy to see all of you. I don't know if anyone has any questions for me. Okay, well, thank you all, and look forward to seeing you.
Thank you. Thanks so much.
You're welcome.
Well, I think, does anybody else have anything they'd like to add at this meeting, or comments?
I would
Doesn't
like
sound like
to,
they do.
Phil, this is Gina. I would just like to encourage anyone who is not getting our emails regularly on Mondays and Fridays, send me an email and I'll add you to our list. If you're a member, you should automatically be getting them, but if you're not a member, we'll add you. It's not an issue. I just want to make sure we have open communication and you know what's going on. Thank you.
That's great. Yes. Thank you. It's very much appreciated. I think we've really reached the end of what we need to do today. But I would, if anybody's got anything to add, love to hear from you. But otherwise, perhaps it might be time for a motion to adjourn.
So moved.
Second.
Oh, Uh, uh, any objections? Hearing none, the meeting is adjourned, and so we'll get out something for next week or next month. Thanks very much, everybody, and thank you, Amy, for
Thank you.
Thank you.
Amy.
Thank you, Andrea.
bye-bye.
Yeah, thank you, Andrea.
Bye.
Stay safe.
Take care.
Bye, everyone.